Good afternoon all. I'm Dr. Rajiv. So my friend has spoken, but we have to look at the larger picture here. So probably he is anti-segment surgeon. So I'm a posterior segment. I'll speak in that perspective. So I have no financial interest.
You should have, man.
So my topic is ophthalmic industry and practice are complementary and mutually beneficial. So the overriding principle guiding doctors' relationship with industry is primacy of patient care. So main thing what comes to my mind is evolution and innovations. We keep to evaluate ourselves like the different industries like drugs, machines and instruments. Drugs such as anti-VEGFs which were previously unthought of need clinical evaluation and clinical trials, which has lot of the industry helps us in evaluation. And evaluation of these drugs have saved millions from going blind. Machines, and as you all know, we have evolved from 20 gauge to 22, 23 to 25 and now 27. So these minor the microincision vitrectomy surgery is now unthought of surgeries previously, so ROP stage 4 and stage 5. Due to this evolution we can do the surgeries and probably save the eyes of many babies. Instruments like Dr. Ajay sir is here. He has designed instrument. When a patient, there's a design in mind of a clinician, it can be conceptualized with the help of industry and design. Like he has his trocar and cannula, which is reusable and which saves lot of cost. It can be cost effective. So main thing that is beneficial for both is evolution and innovations. So main thing, all of this is for the benefit of the patients. See, the newer drugs, the newer machines and instruments eventually improve the patient care. So the patients are biggest beneficiary among all stakeholders. As I had spoken of anti-VEGF drugs, without that millions would have gone blind. So newer technological advances, like as I've spoken of microincision vitrectomy surgeries, and due to these newer technological advances which are impossible without the help of the industry, patient satisfactions are regularly evaluated. And also patient education materials which are provided by the industry. So what are the benefits for the practitioners or organizations? So synergy of ophthalmic industry and practice to a health organization stimulates continuous improvement. It enables the organization in demonstrating commitment to quality eye care and safety, thereby ensures best clinical outcomes. It also provides opportunity to healthcare unit to benchmark with the best. The technology and medicine given by industry provides an objective system empowerment by insurance and corporates. Most of the industry funds nearly 60% of biomedical research for performed. Like we have said, newer drugs or newer anything new needs to be researched and needs to be clinical trials, which are helped by the industry, which eventually helps the patients. The industry also funds graduate medical education fellowships, and industry supports our medical journals through advertisements, purchase of articles, which are helpful for our improvement of our knowledge. So mostly industry likely funds 30 to 50% of most professional medical association member benefits by supporting the annual meetings like our AIOC. So what are the benefits for the industry? They get the newer ideas from the practitioners. Their product sales growth, eventually there's growth of their company, and they have direct and indirect service for improvement of patient care and awareness. So to summarize, the biggest gainer from the association are the patients as they get best and latest management for the diseases. The association is just not for the money, but also for the betterment of human beings. Thank you.
Okay. Dr. Ajay, please.
So it's very difficult to actually say for or against this, but what I'll say is what I feel is that the ophthalmic practice clinicians and the industry should work in tandem, but under a monitored care. In the sense, I do not know if we can tomorrow have something like we have generic medicines. We should have some sort of equipment which our society should be able to monitor the price of that. I think that's what the first speaker in the way was saying, that the prices are exorbitant. If we can monitor that, I think then we can work in tandem.
Dr. KP.
Very difficult.
I think they cannot be exclusive. Obviously, we have to work together for a common cause. At the same time, we cannot rule out the fact that there has been a manipulation. The companies, especially the big ones, they manipulate the popular perception. Okay, so they can probably for a better commerce. So there has to be some via media. Something has to be there in between, for a people who cannot afford beginners, so that there is some way of doing a viable practice with less investment. So that's probably the way around. There has to be some via media, because present situation definitely it's difficult for beginners and small time practitioners.
Like
That is why the
HIV
LDP program to develop leaders who can handle both.
Yeah, like
Yes.
HIV medication, Cipla came up with drugs which was so much cheaper. Yeah.
But obviously there was a huge commerce behind it. You need a lot of
And
financial
if you
support to
develop a
enter.
device, the multinationals don't want to take it up because
Yeah.
it affects the industry.
So